So our second exercise here is called yoga toes. And what Ian's gonna do, he's gonna put one foot over his knee, interlace his fingers with his toes, and then stabilize his posterior foot. This way, this part of the foot isn't moving, and we're getting all the movement here at the end of the foot. Start with, we're gonna pull it down into plantar flexion, and we're gonna mobilize the long bones of the foot here. This is a really great exercise, again, to develop this flexibility in the feet that often, if it's not flexible, if it's real stiff, will create plantar fasciitis and can create Morton's Nueroma and a lot of other foot conditions. And so this is a really great tool that Ian can use here to keep his foot nice and loose. Likewise, after we've done it in plantar flexion, pull it all the way back into dorsiflexion, and we're gonna do it again in that position. So again, just kind of working it back and forth. You really can't screw this up. Just doing some big figure eights, just kind of moving the toes back and forth. You should feel after about 20 or 30 seconds the foot start to kind of loosen as you move it. The next step we're gonna do is you're gonna take two hands and put your hands really close together, all the way up, kind of starting at kind of the base of the ankle here. And we're gonna kind of wring out the arch. And so we're kind of pulling in one direction as we're opposing it with the other hand going in the opposite direction. And just kind of working it back and forth as if you're kind of wringing out water out of a towel. And again, this works really well down what's called the first ray. It's kind of the arch, the big bones in the foot, if you will. And just kind of loosening this up really well. Again, total maybe 30 seconds to a minute and a half, somewhere in there, whatever you feel like you need to loosen up your foot really well. And then we'll switch and do the other side.